Most heart murmurs don't necessarily mean anything is wrong, but sometimes they are the sign of a problem with the heart. Dr. Renuka Peterson of Children's Hospital of Orange County discusses when a heart murmur can become problematic.
Heart murmur is an extra sound between the heartbeat, and a heart murmur can either occur while the heart is contracting or while the heart is relaxing. After babies are born, pediatricians evaluate all the children, listen to their heart, including evaluating their entire body, and if they hear a heart murmur or have concern, at that time they may be referred for further evaluation. And then as children see their pediatrician or primary care provider, at each well-child visit, the doctors will listen to their heart with a stethoscope. So at any point along the way, a heart murmur can be detected or picked up, and again, it's up to the primary care doctor, because many of these murmurs can be normal. If they think there may be a quality that sounds a little different than normal, then they may refer you for further evaluation. Heart murmurs are very common, and many of the heart murmurs are innocent heart murmurs. So it's not uncommon to hear in a family, they'll say, my sister, my cousin had heart murmurs, but in and of itself, the murmur is not familial, but specific abnormalities of the heart can have a genetic predisposition. The pediatrician hears a heart murmur that sounds concerning or they'd like further evaluation, they will often refer the patient to be evaluated by a pediatric cardiologist. In general, we take a listen with our stethoscope to listen again to the quality and the nature of the murmur. If we think it sounds like we need to do further tests, initially the tests we may do include an electrocardiogram, which allows us to look at the heart rhythm and point us to some abnormalities. Other tests include an echocardiogram, which is an ultrasound of the heart. That shows us the whole structure of the heart and all the valves. And then there are other further tests that may be required depending on the findings of those initial tests. Additionally, a chest x-ray may be ordered to look at the heart size and the lungs. A baby who has a new heart murmur in association with other findings the doctor may see, in particular if a baby appears blue appearing or is having some difficulty feeding or breathing, those babies we're more concerned about and do more of a workup. If an older patient is having symptoms with activity, in particular chest pain, dizziness, difficulty doing activity they used to do, or a young baby's having difficulty feeding, hard time breathing, those situations the physician will want to evaluate further. So depending on the cause of the heart murmur, if a heart murmur is, again, what we call an innocent murmur, where there's nothing wrong with the heart, but we hear the extra sound, that can go away over time. Sometimes it persists, but again, if there's no structural problems with the heart, it's nothing to be concerned about. Heart murmurs that are abnormal, depending on what's done to treat those things, may go away, or you may continue to have a small murmur. When they're young like this, we can use a balloon to open that up and just continue to watch things over time.
Okay.
Patients who have abnormal reasons for an abnormal heart murmur will be followed by a cardiologist, and your cardiologist can tell you to be concerned or not.